had 153 patients. These patients, they were all adults, so they were 18 years or older. They all met criteria for chronic migraine by the ICHD-3. So there was a strict diagnostic criteria. They received Onabot first, Onabot being short for OnabotulinumtoxinA, and then later getting the CGRP monoclonal antibody. And this was the time period was May of 2018 to May of 2019. Some other demographics was they were majority female. I believe our average age was 47. Patients on average were on Onabot for, I believe, 40 or so months, which translates to about 12 to 13 treatment cycles. And that's partially important for there are papers that suggest there's further improvement in Botox treatments the more they receive. So these patients on average have been on Botox for quite some time. And we went through the charts measuring change in monthly headache days and change in pain severity. So I'll start with about 114 out of 153 patients reported a decrease in either monthly headache days or headache pain severity. However, as I've been saying, this is a retrospective chart review, and what that means is that we looked at charts in the past. So these providers are documenting things differently. And this is some of the challenges is where, this is quite subjective. Some charts just said decreased pain severity. Others actually gave a numerical change. So of these 153 patients, 66, we were able to get what we call quantitative data, meaning they were specifically their headaches at baseline, their headaches after Botox, and their headaches after CGRP. This is where we got more of the data that we could actually do significant statistical analysis to. One more thing I forgot to mention was the break, because there are three CGRP monoclonal antibodies. A bit over half were on erenumab, I believe 89, and 51 were on galcanezumab, and then a smaller percentage, around I think 9%, that was like 12 or 13 patients were on frimezumab. So when we get to the 66 patients that now we have like much more in-depth numbers to work with. On average, these patients had 25.3 headache days a month. After receiving Botox treatment, this came down to, they had a reduction of 10.9 monthly headache days. That's like a 43% reduction. And this is actually very similar to what the COMPEL trial was. COMPEL was the long-term paper on the effects of Botox injections. So that's sort of, I guess, for me, served as a control. It's like, okay, we have similar numbers, there's nothing crazy going on. After that, we looked at how patients were doing after the addition of a CGRP monoclonal antibody. This was looked at generally 2 to 3 months after they started. We saw their headache day reduction. And they saw, on average, a further decrease of 5.6 headache days a month. And this comes to, when you combine it, a total of 16.6 monthly headache days, a decrease of 16.6 monthly headache days. And when, accounting for statistical significance, when we did the stat work, we did it each step to make sure that it was statistically significant each step of the way. And the other thing we evaluated was, because the other question is, this isn't just, is it effective, is it safe? Because both treatments have their own side effect profiles. So we saw that 13 patients, and it comes to about 8% reported side effects to the CGRP monoclonal antibodies, and that included constipation, fatigue, and injection site reaction. And those were the side effects seen in all the trials. And I believe it's actually a little bit less than the number of the percentage less than what was seen in the actual trials. But and one piece of data that a lot of people at the meeting were picking at was, when I presented this, we actually broke up the data among the 3 CGRPs. Was there a difference among the 3? And interesting enough, erenumab and galcanezumab were almost identical, but frimezumab had a further 2-day reduction. So it was, I believe, like on average, these patients had like 9 or so headache days a month. They had like 5 or 6. So it was actually more of a decrease with frimezumab. And at first, people were jumping on it like, whoa, like, look at this. Maybe, like, this should be the thing, Botox with frimezumab. But as I keep stressing, it's easy to infer that, but you got to remember your stats. This is a retrospective chart review, and only 13 patients, compare that to 89 on erenumab or on rimegepant. So the N is much lower, and therefore it's statistically less power. So while that number sounds very attractive, you got to keep that in the back of your head.